Hi, welcome back to the channel. This is Dr. Walker from denwalker.com, and again, welcome back. Just a quick question I've been getting regarding taking quercetin with zinc and vitamin C specifically. So by default, quercetin has very low bioavailability, which means that the absorption rate for quercetin is pretty low by itself, which is why a lot of folks will say you should have quercetin by itself with perhaps just a little bit of juice or some water, and that should be good. Uh, you really can't take zinc without having something in your belly, because if you do take zinc by itself, then it can burn your belly a little bit. So I don't do that. Initially, I used to take zinc and quercetin together, but again, as I said before, the low bioavailability of the quercetin leads to some decreased absorption. So what I then started doing was adding vitamin C to that combination. Vitamin C is known to sort of help quercetin being absorbed pretty well. So now what I do is I take my quercetin with my vitamin C and the zinc at the same time. So I don't worry about the absorption rate from that regard. If you're going to take quercetin without vitamin C and just zinc, what you may want to do is take the zinc with a little bit of food first and give yourself maybe about 15 or 30 minutes or so, and then go ahead and take your quercetin. And again, because the bioavailability of the quercetin is so low, any amount of or significant amount of food that you have in your belly can decrease the absorption rate of quercetin. So, but anyway, that's what I do. I now take quercetin with my zinc, with some vitamin C, a little bit of food, and that helps me in my absorption from that standpoint. And again, quercetin, again, a wonderful over the counter, but just double check with your provider to be certain that it's okay. There's some loose connection between folks with hypothyroidism and quercetin having some complications with that. But again, quercetin, flavonoids, by definition, found in a lot of things: grapes, onions, red wine, cherries, apples, a whole lot of other things. But again, the amount that you need for an effective anti-inflammatory process is much higher than you can get typically in some onions and grapes and cherries and those kind of things. So it's a good medicine to take, over-the-counter medicine to take, and has some really good properties associated with it. Remember again, zinc and quercetin. Sort of quercetin is the flavonoid essentially that transport or help zinc to be transported into the cell. Once zinc is inside the cell, zinc has some very good properties in terms of inhibiting the replication of viral processes in general, to include coronaviruses or viruses in general. So great combination to take, especially now in the COVID crisis. And for those folks who are, and again, it does make a difference if you're vaccinated or not. These are things that I think, once cleared by your doctor, these are things that you should consider taking, because with breakthrough infections and those kind of things, it helps to sort of boost your immune system as best as you can. And again, this is just one way of doing it. Anyway, if you like what we're doing, go ahead and subscribe to our this channel. Otherwise, you stay well, stay healthy, and do your best to stay safe in this crisis. Thanks for listening again, Dr. Walker.